So, Stacy is a 27-year-old who comes in because she's having difficulty taking care of her baby. She cannot lift her baby, she cannot cuddle him, she's having trouble changing diapers. She remembers that 3 years ago that she had, been playing basketball and realized that each time she would try to throw the ball into the hoop, she would develop aggravation of her wrist joints and she would have to ice and take anti-inflammatory medication. So gradually she did the normal thing, which is just cut back on the activities that she knew would aggravate her joints. So she started to cut back on things like gardening, but her joint pain just got to the point where even when she would sleep on one side versus the other, it would be aggravated. So Stacy comes in because now at this point she's at her wit's end. She has a newborn baby who's 3 months old now, and she's just having trouble taking care of him. Stacy's diagnosed as having rheumatoid arthritis, and the good news is we were able to help her. So my name is Dr. Arinola Dada. I'm a rheumatologist. I help people with joint pain who are concerned about long-term damage to their joints, preserve joint function so that they can live an active life. So let's talk about rheumatoid arthritis. So rheumatoid arthritis is an autoimmune disease where the immune system is attacking the joints. And my best analogy for this is to say, okay, the body is a country and the military is supposed to protect you from invaders. In this situation, something's gone wrong and the military now has its artillery targeting the joints. Okay, so what are there 4 symptoms that I would say are particularly helpful if you're trying to figure out, hey, are these joint pains concerning enough to see a doctor? So one would be swelling of the joints. If there is no trauma and your joints are swollen, there is some problem, right? So for rheumatoid arthritis, joints that are typically involved are the wrist joints. We call them MCP, but they're your knuckles. Elbows, swelling in the elbows, unless there's a trauma, shouldn't happen. And then your feet, kind of a sensation that you're walking on marbles. So 1 is swollen joints, 2 is stiffness in the morning. I think as we all get more mature, there is some stiffness in the morning. But if you start to feel stiff for more than an hour in the morning before you kind of loosen up, that's probably worth getting checked out. People who have those 2 symptoms and also have significant fatigue is another thing to think about. And then finally, if you have associated dry eyes and dry mouth. So those 4 symptoms kind of put together, put one at a high risk for rheumatoid arthritis. Now, the good news is that there is medication and diet modification and a wide spectrum of options depending on how severe the rheumatoid arthritis is. So my name is Dr. Arinola Dada. Please contact us at Overlake Arthritis and Osteoporosis Center if you have any concerns about your joints. Like this video on Facebook, share us, and we will be happy to help you on your journey towards healthy joints. Take care.